I'm Trina Pagano. I'm an OB hospitalist at Cleveland Clinic. So if you've been prescribed a medication by your healthcare provider, it is generally recommended that you see your healthcare provider or your OB/GYN before trying to get pregnant. Some medications are okay to continue in pregnancy. Others have to be altered in dosage or changed to a different medication. And some have to be discontinued altogether. This basically is determined by the benefit to the mother and her pregnancy and the baby versus the risks to the baby. So long before you attempt to get pregnant, you really should address this with your healthcare provider. There is no recommended amount of time that you should stop using drugs prior to pregnancy. Obviously, as soon as possible would be recommended. Some drugs stay in your system a longer period of time than others. And obviously, you have to address the potential for physical addiction to a medication and would need treatment to address that. Drugs in pregnancy can cause not only problems getting pregnant, but miscarriage, stillbirth, preterm labor, small growth of the baby, stillborn, problems with the placenta as well. Certain drugs, such as opioids, which would include heroin, oxy, and hydrocodone, can lead to withdrawal in the baby after the baby is born, called neonatal abstinence syndrome. And these babies need treated and have extended hospital stays. It's always best to be clear with your healthcare provider or your OB/GYN that you are using drugs so that treatment can be provided if necessary. It's been found that buprenorphine and methadone improve the outcomes of both pregnancies and the babies. Stays in the hospital are less. Less medication is needed to treat the babies when you compare to use of illicit drugs. We know that most drugs in pregnancy can affect the baby long term, not just in the immediate period. These babies, because their brains have been exposed to drugs during pregnancy, can have long-term developmental disabilities and need health care for these for a long period of time. All birth control options are available for women who either drink alcohol or do street drugs, providing they don't have any other medical problems, including liver disease or heart disease. But we do recommend the long-acting reversible contraceptives, better known as LARC, because they have very low pregnancy rates and very high continuation rates due to low side effects. Long-acting reversible contraception includes the intrauterine devices, or the IUDs, and these are inserted directly into the uterus, as well as the subdermal implants. These are a rod that's inserted just below the skin on the inside of your arm. These are very, very effective contraceptive methods that require very little maintenance and can be used for many years. So once they're placed, the IUDs can be left in place up to 10 years, and the implants can be left in place up to 3 years. The really nice thing about the long-acting reversible contraceptive methods are that you can have them placed right after having a baby, while you're in the hospital. So the IUD can be placed directly after delivery, after you deliver the placenta. The IUD can be inserted into the uterus, and the subdermal implant can be placed anytime after the baby's born up until the time of discharge.